How does chronic stress affect fertility hormones? Imagine your body as a finely tuned orchestra, where each hormone plays a vital role in creating the perfect environment for conception. When stress becomes chronic, it's like a loud, disruptive noise that throws the entire symphony off balance. Chronic stress impacts fertility hormones mainly by interfering with the hypothalamic pituitary gonadal axis, which is the main system that controls reproductive hormones. When stress persists over time, your body produces more stress hormones like cortisol and adrenaline. Elevated cortisol levels can inhibit the releases of gonadotropin-releasing hormone from the hypothalamus, which is essential for signaling the pituitary gland to produce luteinizing hormone and follicle-stimulating hormone. These hormones are crucial for ovulation, follicle development, and maintaining a regular menstrual cycle. When their levels drop or become irregular, ovulation can be disrupted or missed altogether, leading to irregular periods and lower chances of conception. At a cellular level, high cortisol and other stress hormones can directly affect the quality of eggs. They can promote cell death in ovarian tissue and alter the balance of growth factors and sex hormones within the ovarian follicles. This can reduce the developmental potential of eggs, making conception more difficult. Chronic stress can also impact the uterine environment by thinning the endometrial lining, which is vital for embryo implantation. If the lining isn't receptive, even healthy eggs may not successfully implant, reducing the chances of pregnancy. The stress response involves the hypothalamic pituitary adrenal axis, which interacts with the reproductive system. When stress activates this axis, hormones like corticotropin-releasing hormone and adrenocorticotropic hormone stimulate cortisol production. This excess cortisol further suppresses reproductive hormones, creating a cycle that hampers fertility. Stress can also influence neurotransmitters like dopamine and serotonin, which affect prolactin levels. Elevated prolactin can interfere with ovulation and menstrual regularity. For women with conditions like endometriosis, which already involve hormonal imbalances and inflammation, ongoing stress can worsen these issues. It may intensify symptoms and further impair fertility. Incorporating mindfulness practices, holistic lifestyle changes, and stress management techniques can support hormonal balance and overall reproductive health. However, these strategies should always be used alongside medical advice tailored to individual needs. In summary, chronic stress affects fertility by increasing cortisol and other stress hormones that suppress the hormonal signals needed for ovulation and healthy ovarian function. It can also alter the uterine environment, making conception more challenging. Recognizing the impact of stress and actively managing it can be an important part of supporting fertility and reproductive well-being. Always consult healthcare professionals for personalized guidance, especially if you are dealing with conditions like endometriosis or other reproductive health concerns.